swelling in the neck, difficulty in swallowing, difficulty in breathing, and some kind of pressure on your neck while lying down. So these are certain signs of thyroid nodule. So when a patient has a neck swelling, people say that, yeah, I had a mild neck swelling, let me see. They go to a surgeon. The surgeon says you need to remove the thyroid. They get scared. And that is when we as interventional radiologists give them an alternate option. And that is minimally invasive treatment for thyroid nodule. Thyroid nodule grow over time based on the hormonal changes. So these thyroid nodules initially may be undetected. This is the story of every third person who comes to my OPD. They have been previously diagnosed with thyroid nodule and also advised for surgery. So these patients come to me looking at a minimally invasive options which are done by interventional radiologists. There are 3 different methods of treating thyroid nodule. So before going to that, let me explain you about thyroid gland and the nodule, how it is formed. So thyroid is a butterfly shaped gland which is seen in front of your neck. So this usually regulates your metabolism. When there is Graves' disease or multinodular goiter, these glands increase in size. That is when patient sees neck swelling. And these neck swelling increases over time gradually. Initially, patient says that I just have a small swelling in my neck. Later, they complain of difficulty in breathing, difficulty in swallowing, and pressure symptoms. That is, while lying down, they feel that someone is choking their neck. There's a pressure on their neck. So these are certain signs which patients usually say. And when they do the thyroid test, that is the thyroid hormone test, that is when they realize that thyroid hormone levels are varied. Thyroid gland as such is a highly vascular organ. Once there is a nodule, the vascularity increases. So we as interventional radiologists target these blood supply. That is, by blocking the blood supply, you reduce the growth of the thyroid nodule. There are 3 methods to treat benign thyroid nodule. That is, ethanol ablation. For a benign cystic lesion, we do ethanol ablation. If the lesion is solid, a benign solid lesion, we do something called as a microwave ablation or a radiofrequency ablation. Apart from that, if the lesion is very big, which cannot be excised surgically, we call it as thyroid artery embolization. So what is thyroid artery embolization? Thyroid artery embolization is a minimally invasive technique where we enter the blood vessel supplying the thyroid nodule and block the supply, by which thyroid nodule shrinks. So how is this procedure performed? We insert a small tiny catheter into the blood vessel through the leg or the wrist and reach the thyroid artery supplying the nodule alone. We don't touch the artery that supplies the normal thyroid gland. So the blood vessel supplying the nodule is selectively cannulated and embolized. We use embolizing particle such as a PVA particle to block these blood vessels. So once the blood supply is blocked, the thyroid nodule shrinks over time. And this is a gradual shrinkage. That is, it takes around 3 to 6 months to reduce in size. So what is ethanol ablation? Ethanol ablation is a minimally invasive technique used for cystic thyroid nodule. So here we usually insert a small needle into the cystic space and aspirate the fluid and then inject 100% ethanol and place it for 10 to 15 minutes. After which the ethanol is re-aspirated, through which the cells lining the cyst will get destroyed. The next method is microwave ablation. Microwave ablation is a minimally invasive treatment for solid thyroid nodule, that is, which doesn't have any cystic space. In these conditions, we insert a small tiny needle into the solid nodule and ablate it using heat energy. Here, the microwave produces heat and burns the tissue from within out. With this, the thyroid shrinks over time and gets fibrosed. So what is the benefit of doing a minimally invasive treatment for thyroid nodule? These procedures have no cuts, no scars, no stitches. The patient can go home the same day. Patient can have normal food. There is no restriction of neck movements. Patient can be normal like how he had come before. Anyone suffering from benign thyroid nodule, we offer minimally invasive treatment. You can consult your interventional radiologist.